When you get spinal anesthesia and you have a spinal headache as a complication of spinal anesthesia, what we are always in a hurry to tell you is sorry, 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 and sorry. We won't stop at that. We would usually give you analgesics, pain-relieving medications that would help your headache. Sometimes it works, most times it may not work, because the cause of spinal headache would want to run itself until eventually it fades off on its own. When we do that and it does not work, that is giving you analgesics for the headache. If it does not work, then we encourage you to take caffeine, either from coffee, from Coke, from Pepsi. This would work in most patients. Most patients will find relief from spinal headache from taking caffeine. If it doesn't work, this headache came as a complication of spinal anesthesia, then the last bus stop for treatment of your spinal headache is to get the anesthesiologist again, who instituted spinal anesthesia for you. What will the anesthetist do in this point in time? Is to get into the epidural space and do what we call a blood patch. Blood patch means it would get blood from one of the very good veins in your body and use it to patch the part of your spinal cord that is leaking out the CSF, the cerebrospinal fluid, that is causing the headache in you following a spinal anesthesia. At the end of the day, it works in 95% of cases. If it doesn't work, another blood patch through an epidural route would have to be instituted again. In that case, it also works in another 95% of cases. Whatever happens at the end of the day, your spinal headache would resolve.